Click subscribe and bell icon to get regular notifications.
Neurosurgery has been revolutionized by imaging. CT scans and MRI has been there for the last about 30 years. Before the era of CT scan and MRI, brain tumors and brain problems were diagnosed only based on X-rays and contrast injected to that X-rays like angiography or air injected through the spine or contrast injected through the spine. Things changed when CT scan and MRI could be done and we could directly visualize the brain. Currently, MRI is the gold standard for diagnosing problems in the brain, tumors in the brain, and for evaluating after an operation whether the operation has been successful or not, whether the tumor has been completely removed or not, or whether the tumor has recurred. This MRI technology, if it is available while we are operating, it would be even better, because in neurosurgery, as against surgery elsewhere in the body, we get to operate in deep-seated locations, and certain tumors we cannot differentiate between normal and abnormal tissue. Where the tumor ends and where the brain begins becomes a very difficult decision on table. At that point, we decide to be safe for the patient's welfare and do less than efficient resection, and then post-operatively, if the scan shows still tumor left behind, we decide to do another operation to remove the tumor or subject the patient to radiation as may be required. If we have that information, whether the whole tumor has been removed completely or not, while we are having a doubt on table while during the operation, that will be really valuable to the patient, avoiding unnecessary tumors from being left behind or unnecessary second operation that needs to be done. We can even avoid giving radiation for certain benign tumors like say pituitary tumors if we are sure that we have done the job completely. Intraoperative MRI is one such technology which provides the surgeon with that valuable information which can make the surgery more effective and safe for the patient. Now, intraop MRI is not a new technology. The MRI is already there in every major hospital, and the neurosurgical operation theatre is of course there in any neurosurgical facility in a major hospital. Now, if the MRI can be within the operation theatre complex, then it makes job easier to transfer the patient into the MRI room and get the scan done while the patient is under surgery and under anesthesia before we wake him up from the anesthesia. So this setup wherein the MRI is available within the operation theatre for use in a sterile way for the patient in the middle of an operation under the same anesthesia is called a intraop MRI setup. There are various kinds of setup. We at Yashoda Hospital have the first intraoperative 3 Tesla MRI in the country. 3 Tesla is the strength of the magnet. This gives us more accurate, more sharper images and more faster scanning, enabling thereby lesser downtime, lesser time the patient spends away from the operation table, and quick turnover. This MRI can be used also for regular inpatients through a separate entrance, so the MRI can be productive for both for the radiologist and for the neurosurgeons when we need it. Now, using this MRI facility, we have almost done about 200 and odd cases of intraoperative MRI guided brain tumor resection surgeries, and we find it very useful in tumors like gliomas, in tumors like pituitary adenomas, and even in tumors like schwannomas and meningiomas, where we think we are not going to be able to resect completely and leave behind a residue. Now, how much of tumor we are going to leave behind is only dependent upon our assessment, and which may be wrong. If we do the MRI, we can accurately assess that we are not leaving behind a large extent of tumor and leaving behind only the tumor that cannot be resected. The smaller the tumor we leave behind, we will be able to treat that accurately with another technology called stereotactic radiosurgery, thereby enabling us to do tailored resections even in tumors like schwannomas and meningiomas, preserving all the cranial nerves to which they may be attached, thereby giving a good functional outcome to the patient, at the same time achieving excellent tumor control. This intraop MRI technology, if utilized in this manner, where both radiologists and neurosurgeons can use it simultaneously, works up economical for the patient. It's very cost effective, and only for additional smaller duration of time, on an average less than 1 hour for an operation, we can avoid 2 operations in a patient. We can make the surgery more successful, more efficient and more effective.